Hi, everyone. Welcome to the first episode of the winter season of the Public Health Insider. I'm Catherine Straupel. I'm Director of Marketing and Communications for the College of Public Health and Human Sciences here at Oregon State University.
Hello, everybody. I'm Casey Farm. I'm the Director of Alumni Relations for the College of Public Health and Human Sciences with the Oregon State University Alumni Association. In this episode of the Public Health Insider, we are looking at navigating current public health concerns and how that relates to and influences traveling.
So joining us tonight is Chunhuei, a professor in global health and the founding director of the Center for Global Health in Oregon State University's College of Public Health and Human Sciences. Chunhuei has authored numerous research publications and has mentored countless students in his 32-year tenure with OSU. Since the pandemic, he has given hundreds of interviews to local, national, and international media. Aside from being a media star, he is also interested in pandemic control policies, global health governance, and his expertise lies in health system financing, universal healthcare systems, health and healthcare equity, international health development, and the political economy of global health.
Also joining us is my colleague, Kate Sanders, the Director of Alumni Programs and Alumni Group Travel at the Oregon State University Alumni Association, where she is responsible for the association's signature events and the travel program. Kate joined the OSUAA in 2013 after planning presidential and university level events at OSU. She has a background in project management, event planning, writing, and environmental education. Our webcast series is hosted by the OSU Alumni Association in collaboration with the OSU Foundation and the College of Public Health and Human Sciences.
So a little housekeeping. Following the panelist presentation, we'll leave about 25 to 30 minutes for questions and answers. If you look now at the bottom of your screen, you'll find a Q&A chat button. You're welcome to type questions throughout the talk, and at the end of the presentation, our panelists will answer as many as they can before the end of the episode. So I know everyone's excited to get going, and we have so many questions already submitted, so this is great. We better get started. Chunhuei and Kate, would you please turn on your cameras and we can turn the show over to you.
Hello, thank you so much for having us. We're excited today.
Thank you very much. It's a great pleasure to seeing you. Are we starting now?
Yeah, why don't you start us off, Dr. Chi?
Okay, let me share my screen. I'm going to begin with a very short presentation, and the subject is on the guide to navigate the return to travel. So my short talk have three sections. The first one, I will briefly talk about the phase 2 of this pandemic, and then followed by how we transitioning into endemic. And finally, some tips about hygiene and safety for travels. So the first phase, the phase 2 of the pandemic. So this is the brief time actually started much earlier than we thought in the fall of 2019. And the key event now related to what we are talking about travel is the vaccination that started in December 13 of 2020. So this is the latest statistic. As of last week, globally, we have reached nearly 400 million cases and 5.7 million deaths. And this is the daily new confirmed cases across different continents. So Europe claimed probably the highest. And then interestingly, Africa has the lowest, but at the same time, there might be undercounting because of the lack of diagnosis. And this is the daily confirmed new cases per million. So again, the Europe top of the world the recent daily confirmed cases is still at around 2,000, followed by North America, South America, Asia, and Africa. And this is the daily new confirmed deaths per million. In terms of deaths, the North America is top the world, followed by Europe, South America, and Asia and Africa. And the next slide is comparing the case fatality rate. And I shortened that to comparison between November 2020 to February 2022. So we can see obviously for every continent, the case fatality rate has been declining. So how do we transition into endemic? So in terms of ending a pandemic, there are generally three possible endings: the endemicity, elimination, and extinction. And for the COVID-19, we are not anticipating elimination nor extinction. We are hoping that this year that we will transition into endemicity. And one important factor helping us to transition into that is the vaccination. So again, here is a comparison as of February 4th across different continents. South America topped the world in terms of the continent, 68.2% of the population fully vaccinated, followed by Europe, North America, Asia, Oceania. This is the world, and then the Africa. Besides vaccination, later I will explain, CDC just published the latest result that people without vaccination but infected and recovered, they can gain immunity as strong, if not stronger, than vaccination. So this is a statistic I just summarized today. In terms of the percentage of population infected, this is accumulative as of February 7. So Europe topped the world, about 18% of the population, followed by North America, 15%, South America, 11.6%, and Oceania, about 7%. But Asia and Africa are still at a very low level of infection in terms of population. And vaccination is still highly effective in terms of preventing deaths and hospitalization. And so this is the data from Switzerland, and the unvaccinated is among the top, the highest rate, followed by fully vaccinated, no booster, and fully vaccinated with booster has the greatest protection. And this is another indicator can help us to decide whether a country is relatively safe. This is the weekly new hospital admissions. And I compare the October 10 of last year versus January 30 of this year. And you can see most countries under comparison, their hospitalization rate increased, mainly because of the Omicron. In the next slide, I summarize key factors that will shape the future of the pandemic, the effectiveness of the vaccine, and how well we do mass vaccination in a timely manner, because we are racing against time. The more the virus outbreak, we're going to see more mutated viruses. And we are expecting to see more effective treatment coming out this year. And we are hopeful, and as well as many experts are hopeful, the Omicron could be the endgame variant because of its high contagiousness but low severity. And plus, we still need, for this transition, the old school of pandemic control, the non-pharmaceutical intervention, our willingness to implement them, and our ability to implement them. And then we have to recognize we are in an interdependent world. No place is totally safe until the whole world is safe. And so these are the factors that will shape the future. The green one are the positive to end this pandemic. The pink one are the negative factors. So the global and international collaboration, solidarity, and vaccination treatment. So this will help us end well the pandemic nationalism, individualism, social disunity, and virus mutation will pull us away from ending the pandemic. And Singapore led the world to prepare the transitions. So this is an example of how Singapore, their Ministry of Health, is preparing the population how to safely live with the virus. And in this last section, I will briefly talk about hygiene and safety for travels. So as we prepare to travel, we need to recognize there are different risk factors. First of all is the COVID-19 risks. During the travel, inside airport, I'm talking about international travel, inside airport are among the highest risk, particularly in the immigration and custom if they are not well spaced out, not well ventilated. And the other high risk activity is eating and drinking. And then there are also non-health risks to travel during the pandemic. Cancellations of flights, that's very common. Unexpected lockdown that can happen during the pandemic. And then constantly changing of the isolation and quarantine requirements, and changing airline requirements, and changing border control requirement. And all this means anyone who wants to travel during the pandemic, you need to prepare to allow extra time and money for your budget. There are also the destination factors, such as healthcare capacity and the population immunity level. That is a combination of population vaccinated plus the percentage of population who have been infected cumulatively, and also the infection risk of your destination. And look at the history of how quick, how inclined the country is to do a lockdown, and the variation in border control requirements. And the other one is particularly within a continent, such as within Europe, within South America, or within Asia, you also need to always be prepared the alternative transportations in case that your flight got canceled. And last month, the CDC came up with this latest report indicating the strongest immunity protection come from a combination. So I summarize this here. So the strongest immunity comes from a fully vaccination plus survive a previous infection. And the second is people who survive a previous infection without vaccination. And then the third is people who are fully vaccinated. And most at risk are those people who are unvaccinated and also never been infected. So if you are in this group, it's a high risk to travel at this point. And finally, it's important to know how well you are protected. And keep in mind, there's a large interpersonal variations. The population statistics are useful estimate for population, but not very helpful for individual. And there are some people that may have weaker immune response, such as those with immune compromised conditions, people who are undergoing organ transplant, people who are undergoing cancer treatment. And also proportionally, as we get older, our immune response become weaker. And also keep in mind, our immune response is not static, it is a dynamic state. So if you have a plan to travel, you want to make sure you are at the optimal state of your health, which will reflect in your immune response system. And also given this is a new disease that we are still learning and updating our information, if you have planned to travel, I highly recommend you be aware of updated information and evidence. And the most important thing is practice hygiene safety measures according to your level of immunity protection. And thank you for your attention.
Great. There's some good questions too that are coming in chat. So keep them going and we will get to these questions in just a few minutes. I'm going to go ahead and share my screen. And again, I'm Kate Sanders and I'm the Director of Alumni Group Travel here at the Alumni Association. And I'm going to talk a little bit today just about the changes that I've been seeing in travel and with COVID. COVID has affected us all, but by how much and to what degree really is influenced by our personal circumstances, really. But for tourism, one of the world's top economic sectors, the impact was definitely felt worldwide. Tourism supports 1 in 10 jobs typically, and provides livelihoods for millions more all over the world. And it had global impacts in every sector of that supply chain. In January 2021, the World Tourism Organization stated that tourism arrivals were down by 87% from January 2020. At the end of January 2021, it was reported also by the World Tourism Organization that international tourist arrivals were still at 72% below 2019 levels. Now, if you're a business owner or a leader at a company, what would you do if you were facing a 72% loss for 2 years straight? This is huge. But at the same time, our travelers were also feeling a huge loss. The start of 2020 was tough. Many had thousands and thousands of dollars locked into tours that ultimately canceled. Some did receive refunds. Many received vouchers for future travel or future tour credits. But folks wanted their money back. And the sad thing was the companies had already paid their suppliers. The suppliers weren't giving the money back, so people weren't getting refunds. It was not an ideal situation for anyone. In the midst of this turmoil, companies had to figure out what to do, how to stay alive. And one of the main things that came to the forefront was technology. Information, as Dr. Chi was saying, changes so fast. Countries were opening and closing and changing, and regulations were changing, and there are health passports, then there weren't. And it was crazy to keep up with all of it. We couldn't print anything because by the time you printed and mail it, it was out of date. So email and notifications became the norm. Travelers were forced to look online for updates. Customer service lines were jammed of people trying to get through to different companies. If a company didn't have an online portal for all of the travel documents, they built them. And then they started using them. And the companies that had online portals for travelers made theirs better. Making payments and reservations now became the norm to do it all online, and that is the case now. Digital health passports were created and they are still used today in certain places across the world. Your cell phone became your remote to everything, to getting in a hotel, to going up an elevator, to getting into your hotel room, to checking into your flight, paying for your baggage. No touch is still the way to go. Zoom became the household word. It still is the household word. Birthday parties over Zoom, happy hours over Zoom, events over Zoom. Digital media became our mode of transportation to see the world. We walked the halls of museums. We took guided tours throughout different countries. And to this day, you can still do this. There's a lot of websites out there where you pay a guide in a foreign country or anywhere in the world, and they will take you where you want to go and have a one-on-one conversation with them as they tour you through their computer. We watched live stream performances, concerts by famous artists. We went to the Met Opera online and so much more. Individuals embraced traveling local. So in the US, visit to national parks soared. If you went out camping, you'd be surprised if you could find a camping spot. Camping and RV travel exploded. I mean, you have to reserve your camping spots 6 months in advance these days. And with so many people working from home, workations took on a whole new meaning, and they still are today. Families would travel for months, seeing the world, at the same time doing remote school and remote work. In the health and safety protocols that have been in place because of COVID, I think they're going to be around for a while, which is a really great thing. Definitely everyone along the supply chain stepped it up with health and safety protocols. So what am I hearing now in the travel? Things are getting better. Yes, if you're ready to get out there, it is getting easier. You can take the chance, as Dr. Chi said, if you're allowing extra time and extra money, you will have an amazing experience with shorter lines at exhibits, smaller groups, no crowds. It's the reports I'm hearing back from people traveling, going to the pyramids without anybody in the way. That doesn't happen. It's pretty amazing. You know, I've also seen the concern for travel change. People would be really concerned about getting very, very sick. And now the concern is I may get sick, but that's not what I'm worried about. What I'm worried about is getting stuck. And those are the conversations we're having now, is quarantining and potentially getting stuck. We're seeing a rise in the use of travel agents in group travel. With group travel, you're using a company. Companies are requiring vaccinations for their travelers, so there's a comfort level there. And they also help you with all the documentation and the reports and the regulations and your COVID tests and what you need to get back home. They help you every step of the way. So those have been very popular. As Dr. Chi said, staffing issues are also a major problem with flights and hotels. People are getting sick, so they're short-staffed everywhere you go. So if you do travel out, definitely have patience and don't get mad at the flight attendant or the person waiting behind the desk, because they are probably very overworked and very tired, and it's not their fault. A tip is embrace your smartphone. I still have travelers that do not want to travel with their phones or their smartphones, but honestly, it's the easiest way to get the information, and it's the easiest way to communicate with people when you're abroad. You download the airline carrier's app. So if you're flying Alaska, download the Alaska app. It's the fastest way to find out if you have a gate change, a cancellation, where your bag is, or any of the information that you need. Know where your customer service phone numbers are. If there is a flight delay or cancellation, know where you need to go. Definitely start walking down there and getting in line, but also get on your phone. Get on the phone and call customer service. If you're traveling with a companion, have them also call the travel company you work with or your tour flight agent and try to get help from many ways as possible to get rerouted. It's a race to find the next flight. As I said before, your tour groups are smaller. Reservations are needed to get into key destinations, which is great. Really long lines to get into things. They're not there because you have a reservation, a block time to go, and it's less crowded when you're actually at that destination. And right now, and this is going to change, but right now, companies are more relaxed with trip deposits and refunds. Well, refunding the trip deposit, I should say. Previous to the pandemic, you would place a deposit on the trip, you're locked into that deposit. If you cancel, you lose your money. Right now, a lot of companies are saying that your deposits are refundable up to 95 days before travel. I don't know how long that's going to last, and it's probably not going to last for much longer, but it's really nice that it's there. Cruising. Oh, cruising. Yeah, you'd say that. I always say that there are cruisers and there's non-cruisers. And the pandemic has definitely cemented that fact. With all the bad press cruising has getting, with cruise ships getting stuck, people getting stuck on the cruise ship, you would think that nobody would ever want to get on a boat again. And that's just not the case. Cruise ships are booking like crazy. If you want to go on a cruise, you put down a deposit on that tour because your space is going to be gone. It's amazing on how fast that cruises are booking. So for those who want to do it, they're doing it. If you do go on a cruise, my advice to you is to book your flight and arrive one day early. Just because of all this uncertainty with flights right now, you don't want to miss the first port and trying to get on that boat. Because if you have to try to find your cruise ship and future ports, that's no fun for anyone. What also is hot is bucket list tours. Folks are feeling that time and opportunity are slipping away, so they're going for it. Galapagos Islands, Egypt, Machu Picchu, all of these bucket list tours are very popular. Australia just opened. We have a cruise actually beginning of 2023 to Australia, and it is booking like crazy because people want to go. They haven't been able to go. Other places that are deemed a little bit safer, like Iceland, are booking very fast. Domestic places here in the US, national park trips, Grand Canyon, any of those tours are booking very fast. Europe is picking up, and so is the Mediterranean. Folks are spending more on tours. They're adding more expensive excursions. They're paying for the added extras. They're paying for the extended leg room on flights. They're just paying for comfort and paying for heightened experiences. So we're seeing that a lot in the industry. You know, one thing that got a lot of news was the environmental impact of COVID and the environmental impact of tourism as well. And over-tourism has been a talk in a lot of areas, especially places like Machu Picchu. A lot of areas that talk of over-tourism. And we started to see some places starting to heal because people weren't going there during the pandemic. Smog levels started to lift, improved air quality, sediment in waterways. They settled out, waterways were more clear. There's photographs of the Capuma in Santiago, Chile, walking the main streets. There was a very famous picture of dolphins swimming in the canals. And at first, people were saying that it was in Venice, and it wasn't. There were dolphins swimming in usually very choppy waters in Porto Triste in Italy. There's a picture here of goats walking the streets in Wales. Another one of dogs laying in the middle of an abandoned street in India. So at the same time, tourism dollars help areas, and they help with conservation efforts, and they help with law enforcement to protect wildlife. Those tourism dollars haven't been there. So there's been an increase in poaching. There's been an increase of supply. There was supply chain issues and distribution. So we're seeing some over-harvesting or exploitation of natural resources in certain areas. I mean, that is happening at a certain level. Pollution of improperly disposed COVID protective gear is increasing. I mean, how many times have you walked the streets, looked in the parking lot, and seen a COVID mask laying on the ground? So we are going to see in the next little bit both of these these negative and positive impacts of tourism and of COVID, and they'll become more apparent in the near future. So all that said, positive environmental impacts of tourism, the ecotourism and sustainable travel are now on the forefront. There's renewed conversations about how to make travel more sustainable. And nature-based tours are very popular. Tours that are getting outside, seeing nature, those ones are the ones that are booking. So for a few resources, this is just a really pretty picture in Iceland. So few resources for you. I just want to show you how to find where you can get some information. On the Alumni Association and OSU Foundation website, fororegonstate.org, if you go to the top, you'll see Get Involved. And then you click down, it'll open up a menu and it'll say Alumni Travel. And then that will take you to the travel main page. And on the left-hand side is the list of information from all kinds of stuff that we do for the travel program. And travel resources is one of those. And I'll also add some of these resources in the chat box so that you can see them. But before you go, you want to check out places like the U.S. Government Travel Advisory. Look at the advisory levels. You want to go to the Center of Disease Control and see where the places are, where levels are. You want to go to the World Health Organization website. So I'll drop these ones in chat so you have a chance to kind of see location specific of where things are. And it's always best to do your own research because everything is changing so fast. And the regulations are all over the board. I mean, you've got one country that'll say vaccinated travelers can come, you don't have to quarantine. Another country will say vaccinated travelers can come and children can now come. And it's just all over the place. So you want to make sure you educate yourself before you go. And then of course, we're on Facebook. We have to be on Facebook. So you can always find us here at facebook.com/groups and OSUAA Travel. And now I think we're going to dive into some of your questions.
Hi.
Thank you, Kate. Thanks,
Sure.
Dr. Chi. Wow. a lot of really great stuff. We have a lot of questions during the registration period. We have a lot of questions going on right now. I just want to kind of remind people of a couple different things. One, I see stuff going into the chat, which is great. A little bit tough to fish out, so try to throw your questions into the Q&A button. That's easier for us to find. Two, whether you asked a question during the pre-registration period or tonight that doesn't get answered, we can work with both of our panelists with your contact information to make sure it gets taken care of. So if it doesn't get answered, don't worry, we'll make that connection for you at the end. And so I know we kind of get right into it. And let's see, you know what, let's go ahead and start off. Kate, I'm going to start off with this first one with you. What should you check before making plans to visit another country? I know you started to talk a little bit about those two websites. Is there anything else additionally that you really think that's important besides the things that you just touched on?
Yeah, I think Dr. Chi actually talked a lot about this as well. A lot of people are looking at vaccination rates and they're looking at hospitalization rates. So those are two things that folks are paying a lot of attention to: how full the hospitals are, and vaccination rates to see kind of your general comfort. But the World Health Organization, the CDC, the US Department of State, I've dumped a bunch of these here in chat for folks. Just take a look at a lot of them. You know, another place that I actually go to is I check the information coming out of the UN a lot, because they also have some real excellent information out there about traveling worldwide. So I go to all those. Dr. Chi, would you add anything to that?
Yes, in terms of information source, if you want to have the specific country information, two sources that's very helpful. One is the Oxford University, Our World in Data, whatever you like. And the other information is find the destinations, nations, Ministry of Health. Most countries' Ministry of Health will have English site, and they will also have the most updated information.
Great. Chunhuei, I'll throw you a question. A lot of questions that we've been getting are about how we can best protect ourselves at hotels, on trains, planes, and buses with people of unknown vaccination status. And I will add to that too, we had a question, since you're an expert in Asia, anything specifically applicable to South Korea or Asia?
Well, depending on the time of your travel, because there's a lot of unknown between now and the meaning there's now emerging new, more serious, not necessarily contagious. We're not afraid of contagious. We're concerned about serious symptoms. So if there's no surprise of a new emerging variant that's causing more serious symptoms, most experts expect by this summer, most part of the world, especially Asia, Europe, and North America, South America will be relatively safe. But still, there might be variation across country. So my advice is, first of all, you need to know the country's risk, because there's a variation even within the same continent. And if the country's risk level is very low, it will be relatively safe in terms of masking and hygiene. But if you're uncertain about the country's risk level, my recommendation is wearing a mask, facial mask, during the public transportation, and also in the public indoor places.
Dr. Chi, you know, one of the things that I think we've seen during our pre-registration period, we're seeing it right now, and I know you don't have a crystal ball, but you're probably one of the more on the forefront of the most experts that we have access to. The question about, like, how likely is it that COVID-19 will become endemic by the end of 2022? So to the extent that you are comfortable and with what the information that you're seeing, and our audience knowing that, again, you don't have a crystal ball, what are you seeing? What's the evidence sharing and things are going? I know you kind of touched on it a little bit during your talk, but really, what are you seeing as of today on February 9th?
Well, I'm cautiously optimistic given the current trend. And as I mentioned in my short presentation, that Omicron seems to be one of the gift to us from the virus, that it is highly contagious but far less serious, and it overtaken the far more serious and still contagious Delta. And so continue this trend, plus we still need to improve our vaccination, because the vaccination is our best bet in preventing serious symptom or death in case we got infected. And plus, I'm expecting during this year, there will be a lot more highly effective treatment. So combining these three factors, that the Omicron taking over and more vaccination and more effective treatment, that will help us transition into endemic for most part of the world, except probably Africa might be a bit later, because Africa's vaccination rate, as well as cumulative infection rate, because these are the two factors provide population immunity, vaccination and previous infection. And Africa have very, very low rate on both. So Africa might not be able to move beyond pandemic this year. Asia, Oceania, I'm optimistic as early as this summer that we might be in the transition period. And keep in mind, from pandemic into endemicities is not a big jump. There's a transitional period. It's a gradual process. We will not see it immediately happen, but we will experience that. And I'm hopeful late spring to summer that this will happen.
And I think that's an important component, right? Like that it is a gradual gradient thing, and that it's not like all of a sudden, like tomorrow. I know we want it to be like it'll all of a sudden it'll feel that, but it's going to take a little bit of time. There's going to be some runway between kind of where we're at until where we really get there.
Yes, and the key issue of a transition into endemicities is we may still get infected, but we are no longer afraid of being infected.
Mm-hmm. Yeah, and one thing I wanted to add about Africa, which makes it interesting, is the information and the reporting in Africa has been as good as other countries too. So definitely vaccination rates are down, but the knowledge of actually how many people have been sick in Africa, it hasn't been fully accurate. So that part of it is a piece of the puzzle too to pay attention to.
Thanks, Kate. Catherine, I think you got a question.
Yeah, Chunhuei, you mentioned earlier, and this is a question that came into chat, that people being the level sort of threat level. And you mentioned, the people who, had not been vaccinated, who had not gotten the virus or at one end, people who have been vaccinated, maybe have had the virus at the other end. When you talk about fully vaccinated, the question is how you're defining that. Is that with a booster? Is that fully vaccinated?
The statistic I show from the CDC was without booster. And of course, with booster, that's even more helpful, as we now have evidence. That's the kind of unfortunate shortcoming of the current available vaccines. That is the immunity the vaccine induced, they will decline over a period of time. Most of them decline after 6 months. And therefore, it is important after 6 months to get a booster. However, there's interpersonal variations. That decline can be much sooner for people who have a weaker immune response. And that decline can be much slower and last longer for people who have a stronger immune response.
Mm-hmm. So do you have any indication or any idea of, one of the questions was about, will we just have to keep getting boosters every 6 months, every so often? Is there any guidance or anything that's come out about giving us any indication if that's true?
Yeah, most experts very early on in the pandemic, even before we got our effective vaccine in fall of 2020, most experts already predicted that with effective vaccine, very likely this will become an annual event of vaccination. However, I'm hopeful that as we learn more about the nature of the virus, the nature of immune response, there are many research firms and pharmaceutical companies, they are doing research in developing a new generation of vaccine applying a very different principle. And if that come in time and successful, they will produce a longer lasting, not only longer lasting vaccine, but also more protective, kind of universal protective against most variants. So I'm hoping maybe by next year, some of them will become available. Before that, we might need to have at least annual booster, and hopefully we will be getting kind of a combined vaccine. They combine the COVID-19 vaccine with flu shot, maybe in the fall, before we get a more effective, long-lasting vaccine.
It's nice getting some positive news from our global health expert. That's a nice change of pace over the last couple of years. So keep that kind of stuff coming, Dr. Chi. I love it. Kate, let's talk about testing in foreign countries and returning to the U.S. Like guidance on testing when you're traveling abroad, how to find it. Is it safe? I'm sure it varies from country to country. You know, what are you seeing? What are you noticing?
Yes, do your research before you go. Number one, before you head out, I would just test yourself. Take a home COVID test or go to a lab, which is the better thing to do, and get a test before you even leave or get on that plane. One, there's a lot of destinations that are still requiring it, even if you're vaccinated. But also, if you get there and you get sick, I mean, that's even more problems. So you want to avoid the problem before you're in the middle of it. So do that. I will send them out again. I put a link above about testing kits and the regulations of what the US government requires you to take to get back home. We still have the 24-hour requirement to get back into the United States. So you need to get that COVID test to come back home and get on that flight. If you travel with a tour company, and any of our tour companies that we work with, they coordinate that for you. And it can be hard to find a test and to find it in that quick of a turnaround to get it back. So that is one stressor that at least is relieved when you work with a company to get that return home test. There are options that you can buy and purchase a test in the States before you go overseas. They have to have a telemedicine requirement to it, where somebody is actually watching you do the test and administrating it. So there are specific regulations that you have to follow if you go that way. Some airlines sell them. I think United, actually, you can buy one through United to be able to come back home. And there's a bunch of other places that you can go, and they really range in price when you do those. So there's certain locations they're easier to get, and other places. If you're going to Madagascar, you're gonna have a hard time getting a COVID test. So really kind of depending on where you're traveling.
And it's kind of a follow-up to that, you know, so you're talking about like, you know, testing, you know, when you're there, what happens if you travel and a breakout happens and kind of like that stage. So you're talking about preparation beforehand to try to avoid those types of things. Breakout happens wherever you're traveling.
Yeah, unfortunately, it's happened. It hasn't happened yet to one of our travelers. I say yet because, I mean, it's probably going to happen. I mean, the COVID is just so transmittable, but it has happened to some of my colleagues at other universities, and you get quarantined. That's the fact of the matter. You get sick, you're overseas, you get quarantined. So they'll quarantine you. Now it's a lot of places have lessened the amount of time to 5 days, opposed to it used to be like 12 and 10 days. So now it's less amount of time. Travel companies again help you with securing that hotel room. And in certain places, there's different regulations depending on what country you go to. Sometimes there's a government sanctioned location that you need to go to. Some places it's just you need to stay in your hotel room and quarantine and then be able to test to get back home. But that is what's going to happen, is you will be quarantined. And some cruises, which is pretty great, Oceana Cruise Lines is one of our partners. If you happen to get sick on one of their ships, yes, you'll be quarantined, but they will also refund part of your trip that you have missed. And that is new. And any time before that, they would never do anything like this. As well as if you do get sick on one of their ships, the doctor's visit for COVID-related illness is free. And typically, if you get sick on a cruise ship, the moment you step into a doctor's office on a ship, you can it's just so expensive. It's just, might as well just keep shelling it out. So, I mean, travel insurance is the other thing that I tell everyone you should definitely buy travel insurance, because if something does happen, there's certain parts of the policy that kick in. It could be trip interruption, could be trip delay, and it can be your medical side of the policy. So, and they'll pay out different levels depending on your insurance. But the first thing to do is make sure whatever insurance company you use, they still cover COVID-related illness, because there are a lot of travel insurance companies that have now called it a known issue, a known pandemic, and will not cover you anymore. So you have to ask that question.
Research, research, research.
Yes.
I have a quick comment about quarantine. If you travel international, make sure you are fully aware of the quarantine regulation, because some country will have a very stiff punishment if you violate their quarantine regulation.
Yes, that's very true.
Catherine, you got another one?
Are we close to time? I was going to ask.
We got about 13, 14 minutes. We got a lot of
okay.
questions. So let's,
All
yeah,
right.
let's just keep it going.
Yeah, let's look at questions.
Well, I will go ahead.
Oh, sorry. There are a few questions about, traveling for children or people who were immunocompromised. I was just curious if there were if either of you had any special recommendations for these folks.
For people traveling with children who cannot be vaccinated or with immune compromised conditions, you need to take extra cautions in terms of hygiene, because even particularly for those immune compromised, even if you are fully vaccinated, based on the current data and evidence, people who have immune compromised and fully vaccinated, they may not get the full protection from the vaccine because of their immune conditions. And that means even if you're traveling in a country that doesn't require mask, I would highly recommend you to wear mask in public indoor places, as well as in public transportation, as well as for the children who cannot be immunized. And again, the level of precaution will be proportional to your understanding of the local risk. And that local risk can vary greatly.
Mm-hmm. I have one other quick question, because I keep hearing it from my mother, actually, and that's about, well, I have COVID, I have natural immunity. I hear, excuse me, it got me all choked up. Excuse me. I hear that a lot. What do you think?
You mean people who recover from previous infection? Yes, as I mentioned in my brief presentation, CDC just came out with the latest report based on the data from California State and New York State, and which indicate people who recover from previous infection of the COVID, their immune protection are actually stronger than people who are fully vaccinated but never exposed, never infected. But there's still one big question we don't know. Earlier, I mentioned in my presentation, those population statistics, they are very useful, very accurate in predicting the population. But when it applies to individual, we have to keep in mind there's a huge individual variations. So again, this all depending on whether those of you who have not been vaccinated but previously recovered from infection, whether you have other chronic conditions and those other high-risk factors. If not, then your protection is equal or even greater than people who are fully vaccinated.
Great, thank you.
Thanks, Dr. Cheek. Kate, we're seeing some questions about traveling abroad and about OSU tours specifically with the travel program. Has the travel program suffered any outbreaks? I know you talked a little bit about you'd seen that with some of the other colleges, but has the travel program since kind of going back? Have you been seeing any of that?
We've been lucky. No one has gotten sick. Our last tour was actually, I was on it. It was our Great Trains and Grand Canyons trip in 2020. It was the end of February, beginning of March, and I was on that tour. We were coming home and hearing about COVID, and then we didn't have another trip go out until we had some travelers that went out in the summer, and then one of our first large groups was actually a Channel Islands cruise ship, believe it or not, was November, and it's great what companies are doing. So like example, Channel Islands trip, we all had to upload a negative COVID test prior to departure. We arrived into LA. They put us up in a hotel room. We had to do another test when we got to the hotel room or got to the hotel conference area. Everyone did, passed that COVID test. Then we went into, we called our bubble. It was our travel bubble. And then throughout the rest of the trip, everyone on the boat previously tested negative. We all traveled together. And then we visited the Channel Islands off the coast of California. And again, another outdoor recreation type tour where there was hiking, sightseeing, that type of trip. And it was great. No one was sick. You wear your mask. I mean, you're definitely wearing your mask in all public places. You take it off to eat. We could take a mask off when we were outside, on a hike. We were able not to wear a mask, but otherwise you're masked and you're traveling, and it's been great so far. We have other travel companies that have been running tours through the pandemic. And there has been the occasional one getting sick here and getting sick there. If someone arrived into Iceland with one of my other Pac-12 universities, if they had a traveler arrived into Iceland and they had to test in Iceland at the time upon arrival, they tested positive, they were quarantined, they missed out on their trip. So the risk is there. I'm not going to say that's not there. And what I've been telling people is if you're worried about travel, don't travel, don't go. Like if it makes you nervous, if it makes you worried and you're worried about getting quarantined, then just wait and go when you're comfortable. Because the last thing we want is anyone to be uncomfortable and nervous. They're not gonna have a good time. I mean, travel's about having fun, seeing things. And if you're not in that mindset, then wait until you're ready.
I know you talked about one of the travel about great trains. We do have a train related question, and when I've traveled over to the EU, I love EU rail. It's awesome. Do you have any knowledge of are they doing COVID checks on the borders? Are they doing anything, or is the EU operating such right now where, as it normally does, where it like country to country, like what's going on in the EU, Kate? What's happening?
It's country to country.
Yeah.
What's going on in the EU? I don't know. It changes every 5 minutes. So it's hard. You go to Holland, you go to Belgium, you're gonna have to test here, then you test there, and your test is only good for 24 to 48 hours. So you're gonna have to test again. And then it's all gonna change in a week. So it depends on what month you go, what week you go, what hour you're there. So it's all over the place.
Yeah, that seems really, really stressful.
Well, and that's where company comes in, right? I mean, any company, whether you travel with us or it doesn't matter, anyone you go with, they help you with that. But I'm sure Dr. Chi can talk about safety on trains too.
Oh, Kate mentioned about mask. I do have a very important and helpful tip about mask. If you are on a long travel, whether on a train or airplane, make sure you bring extra mask, because when you wear the same mask, say over 3-4 hours, the mask is going to accumulate moisture. And when your mask accumulate moisture, their penetration rate is much poorer. You need to change your mask. But that doesn't necessarily mean you have to throw away your mask. You can reuse them when they dry. So if you're on a multiple day travel, each day you need to prepare at least 2, maybe 3, that you have to change them after several hours of wearing.
Yeah, and I always tell travelers to bring those face wipes and just to wipe your face off too, because you are just building up germs and moisture on your face, and it's nice just to be clean every once in a while.
Listen to your mother. Wipe your face. Clean your face.
Wipe your face. Yeah,
it's good.
Good hygiene.
I had a couple follow-ups, Dr. Chi, from either at some point in your talk or something that you've talked about so far. I want to make sure they get answered before we wrap up tonight. 2 of them really. How is fully vaccinated defined? Does that include a booster?
Well, right now we are kind of in a gray zone because it all depending on who is defining it. For example, OSU has just recently changed. We are required to have to show the proof of boosters, and this can change as more evidence accumulate. That basically the fully vaccination defined may have a limit time period because we know the current vaccine, their protections are limited. But then we have a gray zone. As I mentioned, the CDC provides evidence that people who are fully vaccinated and recover from an infection, they will have a much longer lasting protection than just merely fully vaccinated. So this creates a kind of a dilemma. How do we prove fully vaccinated? Because it's not just fully vaccinated, given we have a limited protection of infection from the current vaccine, being recovered from a previous infection are also equally important. And so this creates a lot of trouble for government who try to regulate the vaccine certificate or passport, because you have to incorporate those evidence. And again, this will change, continuous change. So I highly recommend people who want to travel, keep updated about those information.
Yeah, there's some countries right now that are requiring a booster shot. So, and then other places that aren't. So it is that's another piece of it.
Before we ask the last question, I've been also seeing in the chat and the Q&A, some things as a reminder, if you've missed part of this talk, we're going to talk a little bit about it at the end, but yes, it is being recorded. So we will show you and tell you exactly where you can find this recording. And if we hadn't gotten to your question, either during the registration period or tonight, we'll make sure that one of our two panelists, depending on the type of question that it is, will get to it. And so the last one, Dr. Chi, to wrap us up, again, under that kind of that fully vaccinated topic, one of our attendees is asking about, like, there are several companies that are making their own vaccines outside of Pfizer and Moderna. I don't know if that's here in the US or if it's globally. I don't know if which one they're talking about. Do those vaccines also count as, quote, fully vaccinated, or are we still in that gray area that you were talking about?
Well, right now, there is a kind of international standard. That international standard is defined by the World Health Organization. And so if you're doing international travel, make sure you look into the list of World Health Organization. Plus, each individual country, they may include additional vaccine that they recognize as fully vaccinated. So again, there's a variation across the border.
Thank you, Dr. Chi. Really appreciate it. And thanks, Kate. Catherine, I think we're ready to wrap up for the evening.
Oops. I muted myself after my little coughing incident there. Sorry for that. This has been super informative. Unfortunately, as Casey said, we're out of time, but I do want to give a huge thank you to both Kate and Dr. Chi for lending your expertise and your time tonight, and for all the work that you do in your respective fields of global health and alumni travel. This has been so helpful for me and hopefully for everyone who tuned in tonight and who will watch it on the recording. A reminder that if you'd like to learn more about the Center for Global Health, you can do so on our website at health.oregonstate.edu/global-health. And if you're interested more in the OSU Alumni Association's travel programs, including upcoming trips and travel stories, as Kate mentioned, go to fororegonstate.org/travel.
We have 2 more episodes in this winter season of the Public Health Insider. So if you like tonight, we have 2 more episodes. Our next one is on Wednesday, February 16th, and we have one more on March 9th. Both start at 5:30, like tonight's episode. Next Wednesday's episode, we'll take a look at current challenges and the critical importance related to caregiving and its uncertain future, one that will affect a lot of us. And on March 9th, we'll take a deeper dive at healthful eating and physical activity habits of kids and adolescents, including how educators and families can improve this generation's health and be positive advocates. To register for these episodes and to rewatch or share tonight's episode, please visit our series site at fororegonstate.org/PHI, which stands for Public Health Insider.
I know we've been giving you lots and lots of web addresses. I'm going to give you just one more, just a reminder that we will be posting a video from tonight's episode on the college's YouTube channel. You can search for us on YouTube, as well as our news site Synergies at synergies.oregonstate.edu.
Lastly, each attendee will receive an email from me tomorrow that will include items for more ways that you can connect with Oregon State University, and including a brief survey about tonight's event. We greatly appreciate if you could take a moment to fill that out so we can bring you more programming from both the College of Public Health and Human Sciences and the OSU Alumni Association that you are interested in. Again, Catherine and I look forward to hosting each of you. If you haven't registered already, you can go to our website and register right now for our next episode a week from tonight on February 16th at 5:30 p.m. Until then, have a very safe and wonderful evening.